why health insurance rates are so high. Very important question. And the answer is, and I'm speaking from the context of employer-based health insurance, not individual, not Medicare, not Medicaid, is there's a huge tension. What is the rate? What is your contribution? If you're an employer, you may be thinking, golly, the rates are so high, and they probably are. As someone who's been in the business for 16 years, they probably are high rates. And a good job of a broker and advisor is try to get lower rates. But regardless of what those rates are, your employees don't care. They only care about one thing: how much is coming out of that paycheck. So I want to share some data. I want to talk about what the average cost of health insurance is, but that does not mean what you as an employee are paying or what you as an employer should pay. So the average cost for a health insurance plan is $718. As good as the staff are, they don't really care. They care nothing about that. The question is, how much are you as an employer, Mr. or Mrs. Employer, going to pay of that average cost? This is the cost to enroll just one employee at a small business. What are your competitors doing? What are other small businesses doing? And this is hard data to compile. You can't necessarily go to Google or AI and get lots of thousands of small businesses data because they're not publicly traded. So there's some sources that BIS gets. I'm talking about one source today, and we have others you're welcome to reach out to us about. But the average contribution, okay, what does an employer pay? $580. The staff is going to pay the difference, $138. You need to find a health insurance plan in your offering to your staff or potential staff members in your new hiring just to keep up with the average. That's $138 or less. Now, there's big difference in cost between a $500 deductible or a $50,000 deductible. Those usually don't get that extreme, but generally speaking, this is based off of a deductible of $2,300, kind of a middle of the road. If you're an employer and you're listening to this and you're experiencing an increase and you're frustrated with prices, I hear you. I'm a business owner too. I get frustrated with these prices. But when the dust settles and you have to make a decision on what you're going to offer your staff, you need to ask yourself a question. Am I at least offering one plan where the employees are paying that monthly out of pocket? That is a harder conversation when your rate is double this. And we do have clients based to, unfortunate situations. Maybe they have some people going through some major health conditions. Maybe they have some adverse selection within their group. Bottom line is the rates could be higher than that. The question is, will your employer contribution keep up with the difference? Because ultimately the staff cares what's coming out of my paycheck. And if your contribution cannot keep up with inflation, your employees will look at this, if this goes up, as you gave them a decrease. That is the facts of the marketplace right now. Now, a good broker is going to try to get this rate lower. They're going to try to do some other things, but a good broker is also going to hopefully care about you and tell you the truth of where your contribution is. So if you're listening and you're a new company and you're growing and you don't have a health insurance plan that you're offering in the marketplace, we don't even need to quote out insurance. We can simply say, how much are you going to contribute? If you have 10 employees and all 10 take the coverage, 10 times $580 a month. I already know what your expense is going to be if you just want to be average. Now, if you want your staff to pay zero, you're probably going to have to look to contribute closer to $700 a month per full-time employee. I didn't say this would be inexpensive. I said, why is it so expensive? Hopefully you've enjoyed this lesson. If you want to find out more, if you want to have more data that supports this, we're happy to supply it for you. Thank you.